Welcome to another episode from the Veterinary Research Channel. Surgical site infections continue to be a significant concern in veterinary medicine, particularly following complex orthopedic procedures like the tibial plateau leveling osteotomy, often abbreviated as TPLO. Today, we're diving into a recent study published in Veterinary Surgery that investigates a potential method to reduce these infections: the use of antiseptic lavage during the surgery.
That's right. The tibial plateau leveling osteotomy is a very common surgical procedure used to treat cranial cruciate ligament disease in dogs. While it's generally successful, it does carry a higher risk of surgical site infections compared to other clean surgical procedures. The incidence of these infections after tibial plateau leveling osteotomy has been reported to range from less than 1% to nearly 16%.
And these infections aren't just a minor setback. While superficial surgical site infections might respond to antibiotic treatment, deep surgical site infections, especially those near implants, often require the removal of the implant to resolve because bacteria can form biofilms. Beyond the health impact on the dog, treating these infections also comes with a substantial financial cost. A study from 2014 estimated the average cost of treating a tibial plateau leveling osteotomy surgical site infection was over $1,500, and the annual cost across the United States was between $9.6 and $15.9 million.
Because of these risks and costs, veterinary surgeons have explored various strategies to reduce infection rates. Routine prophylactic antibiotics administered after the surgery have been a topic of discussion. Some studies suggest they decrease the incidence of surgical site infection after tibial plateau leveling osteotomy, while others disagree. There's also concern about how using prophylactic antibiotics impacts the development of bacterial resistance.
To find alternative non-antibiotic approaches, researchers have looked to human medicine. In human patients at risk for implant infections, an antiseptic lavage solution was developed. This solution contains ingredients like acetic acid, ethanol, sodium acetate, benzalkonium chloride, and water. It's designed for local application after implants are placed but before the surgical site is closed. This particular antiseptic lavage is reported to be compatible with orthopedic implants, effective against biofilms and resistant bacteria, and capable of reducing the local bioburden. Clinical trials in human patients undergoing revision total knee arthroplasty showed a significant decrease in bacteria and a reduction in postoperative periprosthetic infection rates. A version of this human product was adapted for veterinary medicine in 2019.
So, the objective of the study we're discussing today was to determine if using this preclosure antiseptic lavage during tibial plateau leveling osteotomy surgery in dogs would decrease the overall incidence of surgical site infections to less than 5% when compared to the traditional technique of using saline irrigation. The researchers hypothesized that dogs receiving the antiseptic lavage before wound closure would indeed have a lower surgical site infection rate compared to those receiving saline irrigation.
The study was designed as a multi-center retrospective study, reviewing medical records of over 1,400 dogs that underwent tibial plateau leveling osteotomy procedures between December 2019 and October 2021. The data was collected from 6 veterinary referral hospitals. Dogs were included if their surgical site was irrigated with either the antiseptic lavage or 0.9% saline between the implantation of the plate and screws and the wound closure. All included dogs also received intraoperative antibiotics. The researchers collected information on dog characteristics like signalment, whether it was a unilateral or bilateral procedure, administration of postoperative antibiotics, the specific antibiotic used, the surgeon, and whether a surgical site infection developed within 90 days after the surgery. They analyzed 11 factors for their association with surgical site infection. The diagnosis of surgical site infection followed the guidelines from the Centers for Disease Control and Prevention.
Now, let's get to the results of this comprehensive study. A total of 1,422 dogs met the inclusion criteria. 519 of these dogs were treated with the antiseptic lavage during their tibial plateau leveling osteotomy surgery, and 903 dogs were treated with sterile saline lavage.
And what did they find regarding surgical site infections?
Surgical site infections were diagnosed more frequently in dogs that received the preclosure antiseptic lavage than in those that received saline irrigation. Specifically, 77 out of the 519 dogs in the antiseptic lavage group developed a surgical site infection, which is about 14.84%. In the saline irrigation group, 80 out of the 903 dogs developed a surgical site infection, which is about 8.86%. Looking at the entire group of 1,422 dogs, 157 were positive for surgical site infection, making the overall rate 11.04%. Of those 157 infections, 96 were classified as superficial surgical site infections, and 61 were classified as deep surgical site infections.
So, the initial hypothesis was not supported. The antiseptic lavage did not decrease the incidence. In fact, the rate was higher in that group.
Correct. Using univariable analysis, administration of the antiseptic lavage did not decrease the odds of tibial plateau, leveling osteotomy surgical site infection. In fact, it showed an odds ratio of 1.8, suggesting increased odds, though the p-value for this specific analysis was 0.001. Multivariable analysis also showed increased odds for the antiseptic group compared to saline, with an odds ratio of 1.6 and a p-value of 0.042.
Were there other factors associated with an increased risk of surgical site infection?
Yes, there were several other significant findings. Single-session bilateral tibial plateau leveling osteotomy procedures significantly increased the odds of surgical site infection by 2.5 times compared to unilateral procedures. Heavier dogs were also associated with an increased risk of developing a tibial plateau leveling osteotomy surgical site infection. The odds of surgical site infection increased by 11% for every 5 kilogram increase in body weight.
That's interesting. What about other patient factors like age or sex?
The study found that the dog's breed and age at the time of surgery were not associated with tibial plateau, leveling osteotomy surgical site infection. The dog's overall sex was also not associated. However, in paired comparisons, male intact dogs were found to be 2.5 times more likely to have a surgical site infection than spayed female dogs and 2.4 times more likely than male neuter dogs, although these specific comparisons had a p-value slightly above the typical significance threshold.
The study also looked at surgical and postoperative management factors.
That's right. The performance of additional surgical procedures during the same anesthetic event, the intraoperative use of iodine-impregnated adhesive surgical drapes, and the local infusion of liposomal bupivacaine during tibial plateau leveling osteotomy were not associated with surgical site infection. However, postoperative administration of antimicrobials decreased the risk of surgical site infection. Almost 98% of dogs diagnosed with surgical site infection received cefazolin intraoperatively. Postoperative antibiotics were prescribed in most cases, with cefpodoxime being the most common. There was also a correlation between the surgeon performing the tibial plateau leveling osteotomy and the risk of surgical site infection.
Did they identify the types of bacteria causing these infections?
Yes, they did. Of the dogs diagnosed with surgical site infection, about 75.8% had a culture and sensitivity test performed. About 81.5% of those showed bacterial growth. Alarmingly, over 55% of the positive cultures had multi-drug-resistant infections. The most common bacterial isolates included methicillin-resistant Staphylococcus pseudointermedius, other methicillin-resistant Staphylococcus species, non-methicillin-resistant Staphylococcus species, and various other bacteria like Pseudomonas, Streptococci, Enterococcus, and Escherichia coli.
Shifting to the discussion, these results regarding the antiseptic lavage are quite surprising, aren't they? The study concludes that the antiseptic lavage solution evaluated did not decrease the incidence of tibial plateau, leveling osteotomy, surgical site infections, and even resulted in a higher number compared to saline lavage.
Absolutely. This was an unexpected finding, especially considering the reports of this lavage reducing bioburden in human knee surgery. The researchers rejected their hypothesis that the antiseptic lavage would reduce the incidence to below 5%.
They explore potential reasons for this discrepancy. The antiseptic lavage's effectiveness in human patients has been described predominantly in revision procedures where surgical site infection already exists, rather than as a preventative therapy.
That makes sense. The antiseptic lavage is known to work, in part, by disrupting biofilm, which is a key component in established infections. If there isn't an active infection or significant biofilm at the time of a routine prophylactic application, its primary mechanism of action might not be as effective. Biofilm-based infectious diseases are a major issue in human medicine, representing up to 80% of all infectious diseases. The extracellular polymeric substances matrix in biofilms creates a barrier that protects bacteria from traditional antibiotics and the body's immune system. The antiseptic lavage aims to disrupt this matrix, exposing the bacteria.
They also mention the application technique. In a human study, this product eradicated planktonic bacteria quickly, but required a longer exposure time to target mature biofilms. It was also more effective against biofilms on certain implant surfaces and when applied under pressure.
Right. In this study, the antiseptic lavage was pooled in the surgical wound for only 1 minute. This shorter duration and lack of pressure compared to a pulse jet might have influenced the results. Also, while the product can reduce bioburden, there was an initial increase in culturable bacteria in another study, potentially because bacteria were released from biofilms, which then might have contributed to infection if not fully cleared.
Given that a routine tibial plateau leveling osteotomy shouldn't have an active infection, the antiseptic lavage was used here preventatively. The study points out that while it might reduce bacteria present during surgery, it lacks residual properties to prevent future surgical site infections. This suggests it might be more beneficial when used against existing infections or during implant removal procedures.
The study reiterates that the increased risk of surgical site infection following tibial plateau leveling osteotomy compared to other clean procedures is still not fully understood and is likely due to multiple factors. Their finding that increasing body weight correlates with increased risk aligns with previous research. However, their finding that single-session bilateral tibial plateau leveling osteotomy increases risk contradicts some other studies. They suggest this might be due to variations in surgeon practice or the inherent risk of the procedure.
The correlation between the surgeon and the risk of surgical site infection was also noted. However, the study had limitations in assessing specific surgeon variables like technique, infection reporting, or potential carriage of resistant bacteria.
The importance of antimicrobial stewardship is also discussed. Routine, prophylactic postoperative antibiotic use, while sometimes reported to lower surgical site infection risk, poses a risk for developing multi-drug-resistant bacteria. Since the antiseptic lavage didn't reduce infections, they suggest exploring alternative non-antibiotic options, such as povidone iodine lavage, which has shown promise in other orthopedic surgeries.
It's clear that despite these results, further research is needed to identify effective methods to reduce tibial plateau leveling osteotomy surgical site infection risk, given the frequency of the procedure and the implications of infections. The study highlights that a prospective, randomized evaluation of this antiseptic product, perhaps in a population where biofilm is suspected, could provide more definitive answers.
The study itself had several limitations common to retrospective studies, including reliance on the accuracy of medical records and the inability to control for all potential confounding factors. Data was pooled from multiple hospitals, which means variability in protocols, surgeon techniques, and infection reporting practices couldn't be standardized. Also, because the decision to use antiseptic lavage versus saline wasn't randomized, there could have been selection bias, where the antiseptic might have been used in higher-risk cases.
And the diagnosis of surgical site infection following the Centers for Disease Control and Prevention guidelines doesn't always require a positive bacterial culture. While most suspected cases in this study were cultured and diagnosed by a surgeon, there might still be some variability in diagnosis interpretation.
Despite these limitations, the study provides valuable data indicating that the specific antiseptic lavage tested, used prophylactically in this manner, did not reduce tibial plateau leveling osteotomy surgical site infections and even showed a higher rate compared to saline. This suggests that relying on this particular product alone as a preventative measure during routine tibial plateau leveling osteotomy may not be effective.
Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.